blanket ban. They're against blanket bans because people become complacent about what the condition means for them. And they actually say the same about nut allergy, which is interesting. If you have a cooking activity, and I've seen it happen in this school where kindergarten made gingerbread men, you've got two options. You can choose all gluten-free ingredients, which is quite expensive if you have a celiac child in your class, or you can find alternatives. Let them do something, do theirs first so it doesn't get contaminated by everyone else's, and then move on. In my teacher resources, I've found a gluten-free Playdough, because Playdough is something that little kids will get in their fingernails, they'll stick in their mouth. It takes 2 parts per million gluten to be detectable. If you think of a Jack's cracker, that big, the amount of gluten on that could upset and make a celiac sufferer have an episode is so small you will not even see it on the tip of your finger. 6 microns is how big it needs to be detectable. Alright, so what do I do if gluten comes into my classroom? Well, don't panic! It's not going to be the end of the world. Okay, really important rules, and these are basic hygiene rules that you're doing them anyway. So the important thing about the research thing was that I didn't want to say, oh my God, teachers, you now have to do this. It's stuff you're doing anyway, but here's another reason why you're doing it. Hand washing. You know, okay, you've been playing with Play-Doh, you forgot that Leo was there and he was using Play-Doh. Leo, go and wash your hands. Get as much of it off as you can. Don't stick your hands in your mouth. You know, remove them away from the source of where the gluten's coming from. Any utensils you're using, any cooking activities or activities where you're using flour, you know, if you're writing in, you know, if you're doing letters on the desk and things like that, make sure everything's cleaned away so there's no traces of it left later. Cross-contamination is when most celiacs who are sticking to a really good diet are going to come into contact with gluten. Now here is a quick example. Here is a brand new butter container. It has no gluten in it. And I know this because most butters are gluten-free. This one, however, has had margarine, toast, buttered, all sorts of things. So I can see, because this has come out of my fridge, I can see there's some Vegemite, I can see some crumbs from bread. This has got gluten in it. Cross-contamination is where most celiacs are going to come into contact with gluten. And that's where it's really important, if you're doing activities with kids, to be mindful of that. In our house, if we're making toast, we still eat normal toast, or we have 2 toasters. And a tub like that for 6 people, we might use 8 or 9 knives. Scrape it on, in the sink, get another knife. So that way we're making sure things aren't getting contaminated. Sharing of food, particularly for young children, is also really is a great risk. And that's one of those things you need to talk to children about. You know, you need to make sure they're aware. You cannot share food. You can't share food with Leo. You know, talk to him about it, but you can't share your food with him because we don't know what might be in it. So, should my school impose a blanket ban? No. As I said, the Society for Clinical Immunology and Allergy say no. It doesn't, it works, but it creates complacency. Those are the guidelines I was talking about before, knowing practical strategies, the same sort of thing you would do for a child who has, you know, anaphylaxis. Have a medical and action plan, talk to the parents, make sure you know what you're getting yourself into, and education, both of teachers and of other caregivers that are involved. I just want to quickly, I'm not going to read all of this, but there's some really important stuff. These are direct quotes from some of the research that I've done. And one of them, which is particularly important to us as educators, celiac disease begins in infancy. It is very likely that opportunities to diagnose the other 4/5 of celiac disease sufferers do occur when symptoms and complications of celiac disease trigger contact with health and possibly educational professionals. That's us. We're the people who are going to come into contact. We're going to notice the children who are acting in a way that might make us say, does anyone in your family have celiac disease? Because I noticed Billy blah. Ladies and gentlemen, thank you so much for listening. The buzzer went off, which means time's up, and there is some snacks to go. Any questions? Yeah. No. I'll just quickly grab these out of the oven.
They are tended down, it's all good.
Thank you.
Of everything.
Yes.
Okay.
Absolutely.
Second question.
Sometimes it was often diagnosed as malabsorption, and going, okay, well, you know, you just need to eat better, which doesn't always.
Now, what happens if a celiac person actually eats or get this
Yes.
gluten in?
Okay,
So
so
they go into a seizure or
no,
what happens?
that's the thing. This is where it's invisible. Like some of those other conditions,
Yeah.
it was, you know, someone with a nut allergy, for
Yeah.
instance, will start
Yeah.
going into having that sort of reaction. But what will probably happen, depending on the severity, they might break out in hives. They might start coming out in welts on their skin. They might start vomiting. They might have chronic diarrhea straight away. They might just be irritable and want to go and have a sleep. You know, or nothing might happen at all. This is the thing. It's because it's all happening inside, and this is where it gets difficult for training children. And this is why it's important that children understand their condition as well. As they get older, they go, well, you know, I'm not rolling on the floor. I'm not. I'm not losing breath. It can't possibly be doing that much damage, but it is. You know, 30% of sufferers will develop some form of lymphoma. They'll develop some form of bowel cancer, and you know, a good chunk of them will develop a secondary autoimmune condition, commonly type 1 diabetes. So all these things are going on unseen. So it's really difficult, and I can see where a child who was maybe 10 or 11 and first diagnosed, to say, all right, all of a sudden, sorry, but really, all of that pizza's off limits. That's now off limits. That's off limits. That's going to be really difficult. I think we're lucky in our case study. Leo was 2 when he was diagnosed. He's never really known any different, and he has quite amount of pride and ownership, which is what we've tried to encourage in him, of his disease. Now, when he went to school, no one at his school knew anything about it. So we were talking with the teachers and having much this same sort of conversation. And we do the whole thing. We provide food. You know, lunch order day is on Monday. He doesn't miss out. We go to the shop, we buy gluten-free things from the freezer, stick in the school freezer. So on lunch order day, he puts his lunch order form in. Ladies in the canteen know how to deal with it, how to prepare it so it doesn't get contaminated, and he gets it. So he sits on the benches with everyone else in his class who has a lunch order, because they only do lunch orders 1 day a week at his school. So it's all about participating and being involved in the activities that everyone else is, and not making it something that's different. Feel free to come and have some nachos. These are just simply, why you would use wheat and corn flour and not corn flour is beyond me. But the thing is, there's a lot more gluten-free products, and part of this little demonstration was, look, these are just normal products. So in our house, I'll keep those for myself, but those things there would be in our cupboard normally, and we will cook with those at any time. You know, pretty much there's a big industry on, you know, gluten-free products, which are ridiculously expensive, but by and by it doesn't need to be. You know, you can basically get by with most everyday products, even things like this. You know, cooking stock, you know, it's gluten-free. So yes. Thank you. Do you want some juice?
I don't
Thank you.